one touch made my heart ignite and come alive like a million stars.
Morning, YouTube. So sorry that I look like a train wreck. I have these giant bags under my eyes, but it is about 3:45 in the morning, and I am at the airport because I am going home to see my wonderful family. I'm going to go home for about a week, so I'm just going to go home, don't have anything planned, just spend time with my family and my wonderful nephew who is 6 years old. I miss him so, maybe 5 years old. I miss him so much, and I'm just so excited that I get to go home to see him. Well, so what this video is going to be about is that I am going to be talking to you guys about my surgery rotation. So just a general recap of my surgery rotation. I'll give you some basic tips and then just kind of tell you how the shelf exam went. Alright, so let's get into it. So let me give a recap of what the average day would look like. Alright, so I'd wake up around 3:45 or 4 a.m. Get to the hospital about 4:45. About 5 o'clock we do pre-rounds. So that is you going to wake up your patient, going to tell them good morning and ensure that they have a great start to their morning. You're the first thing they see, so make sure it's something pleasant and something to start their day off amazing, okay? And then after that you go see all your patients. Then you come back at 6 o'clock, you do the rest of the rounds with the residents, and this is where you get to present your patient to them. You may have 4 patients a day, 5 patients a day, so you really need to make sure to get to the hospital early and know everything you can about your patient. 6 o'clock, that usually go till about 8. And then really from 7:30 till, well, the end of the day, the rest of the day is doing surgeries, getting in on as many surgeries as you can. Right, and if you're not doing that, you try to study in between, and that's kind of where it gets a little hard, which I'll talk about that. Or it could go even into the night. We have this one surgeon that loves to work all through the night, so if you stay with him, you'll be there till 2 or 3 in the morning. But usually, the average day would be surgeries from 7:30 to 5 p.m. and get in as many surgeries as you can. Let me get into what I get asked all the time is, what do you actually get to do during a surgery? Alright, so a lot of that is dependent on the surgeon. So just in general, some things that you for sure will be able to do, and so that you can watch some YouTube videos on, which I will link below, is one is learn how to suture. Learn how to suture and to tie knots. Those are some of the first things that maybe as a doctor or a resident that they do all the time, that they do not mind if you do. So if you know how to do it, then that will give you a leg up, and you'll be able to start doing more and more things in surgery. And all the time you're going to get asked, well, have you ever done this? Because remember, in my first video, I told you guys, make sure to ask if you could do anything, okay? Just when you're in the OR, just ask, so that you could do as much as they'll let you do, okay? And so what they're going to ask you is, have you ever done this before? And you really want to be able to answer yes. And even if that be in practice, or that you've trained so much to do it, maybe not on a person yet, maybe on a cadaver or a chicken leg or whatever you're practicing with, you really want to be able to say you've done that. You'll be able to bovie. So what that tool does is it will coagulate and cut, to help you get deeper into the tissue. So you should be able to do that as well. And then also is when the surgeon is working, when he's using the bovie, or when he's dissecting, you really want to make sure to have the suction ready and always be sucking the smoke from the bovie, and always be sucking up the excess blood, because they want a good visual field, and that smoke just doesn't smell the greatest. So make sure you're on top of that. And then anytime a surgeon grabs a suture or grabs a needle, make sure you get the scissors ready, because you're going to need to cut. Alright, and you really want to seem competent and know what you're doing when you go in the OR. So just some quick things to make sure that you do is suck the smoke, suck the excess fluids, and whenever you grab a suture, make sure you grab scissors to be ready to cut. And then some other things you may be able to do, just hold your retractors whenever you do a total knee, or even something in the abdomen. You may be able to hold the retractors back for them. Again, making sure they have something that I talked about in my video that I was able to do is I did have the opportunity to use a guillotine saw, and then also use a power saw to do an amputation. I do not know if that's typical for a third-year student, but for me it was absolutely incredible, and I thought that was just a great experience. You're wondering, is what is scrubbing in? Well, probably up to about 3 weeks. That's what every clinical student wonders, because it seems as if no matter what you do, when you go in, you cannot do it right. So here's some quick tips on how to make sure you scrub in correctly. Alright, number one, you walk in, make sure you have a cap on and the booties, okay? And not only that, a face mask. So make sure you have all that on before you walk into the room. And then when you walk into the room, introduce yourself. to everyone, and you should already know their name because I told you to introduce yourselves to them in the first video, okay? So talk to everyone and make sure you're happy. So that immediately will put them in a good mood, so they're less likely to critique you on everything else. Okay, well, when you get into the room, make sure you put gloves on. The patient probably will not be asleep yet, so go talk to them, make sure they feel comfortable, and then after that, you're going to help the nurses get the room set up. After the room's set up, the surgeon comes in, make sure you talk to them, and then they'll be like, all right, now it's time to scrub in. Alright, now you'll go outside, you'll use all this fancy hand soap, make sure your hands are nice and sterilized, and then when you go back in the room, you will get a towel to dry your hands, make sure it does not touch you, dry your hands, and then they will gown you. And then after they gown you, they'll put your gloves on, you'll hand them this little ticket, and then you'll spin in a little circle, do a nice little dance with them, and then they'll tie it off, or you'll tie it off, okay? And so that's your gown. And then after this, you cannot touch anything that is not sterile, and that's one of the biggest pet peeves of doctors. So make sure you do not contaminate the sterile field, all right? This is kind of like an intimidating thing because you're new to it, you're not very good at it, and it's something that we should easily know how to do. But, you know, they'll train you, they'll teach you how. The main thing is just don't be intimidated by it and just have a lot of fun and just be joyous. Be joyous with everyone that is in the room, and it should go well. Alright, so rapid fire of the resources that you need. 1. Surgical recall. This is for studying up before your surgery for as the surgeons pimp you so that you sound really intelligent. Studying for the shelf exam, you need 2 main resources. I would say online med ed with the PDFs and the online videos. They are absolutely incredible. If you do not want to pay for the PDFs, just use online videos. And the Pistanas. Pistanas I've talked about a ton. It is a very small book, but a very, very, very powerful book. And really, if you know surgical recall, online med ed, and Pistanas, and you should do great. But for just a general knowledge basis, make sure you get a good surgery book and be reading that throughout your rotation. And that's just for a general base of knowledge so that you know about the procedures, how they happen, how they occur, and just surgery in general. Alright, so the next thing I'll talk about is how do you find time to study during the surgery rotation. You're working crazy long hours, you're always tired, so how do you do it? Alright, so number 1 is, you know, how do you always stay inspired to study is to think about your patients. Think about what you're studying for. That you're not studying for yourself, that you're studying for the glory of God, and that you're studying so that you better serve your patients one day. So that's where you can get motivation from. And then all throughout your day, you're going to have different 10-minute breaks here. Those are 10-minute breaks that are going to help you succeed in the surgery rotation, because anytime you get a break, be doing UWorld questions. Speaking of UWorld questions, main resources that needs to go back in the rapid fire resources, so do not forget that. Okay, so be doing UWorld questions, be reading Pistanas. What's so great about it, it fits in your scrub pocket, so you can always have that with you. And if you get a 10-minute break here, 15-minute break there, make sure that you're studying. Okay, so optimize your downtime. In your downtime, be studying. Even if it's a 10-minute section here, 10 minutes there, make sure you're doing that. Alright, another thing is read up on every surgery you do. So if you do that for every surgery, then you should know the general basis of all the surgeries by the time you're done. Outside of those, you know, 10 minutes of heaven that you might get throughout the day, make sure that you study for 1 hour when you get home. Okay, and it may be a very long day, but at the bare minimum, study for 1 hour whenever you get home. Okay, now you may have more time to study for that. If you get home at 5 o'clock, your butt better be studying more than 1 hour. But if you get home at 8, 9, just study for an hour and then get some rest. Best advice is use this time to engage and be on the floor. The more that you're engaged on the floor, the more that you're going into every room, making sure you know every patient, making sure you're taking down every dressing, just the more that you're engaged in just loving surgery, the more you'll move, the more that you'll learn throughout this rotation. This is a time where you get out of the textbook, that you get away from conventional ways of studying, and that you learn hands-on. This should be a very, very exciting time for a medical student, because you just spent the last 2 years sitting on your butt studying in a book, and now you get to go studying by loving every patient you see. This should be an exciting time. So the best way to study is be very engaged, be very excited, and attack every day. Hey everyone, meet Talia. She's sitting next to me on the plane. Her boyfriend's supposed to be there. She said he didn't come today. Alright guys, so I just landed in North Carolina. My next flight will be headed towards Memphis, and then we have a 5-hour drive to Springfield, Missouri, where my nephew's having surgery today. Okay, so the next thing I want to cover is how to do well on the surgery shelf exam. So I had the exam yesterday and I felt like it went really well. I hope it went well. We'll see. But pretty much what I would recommend is, first things first, is make sure to go through Pastanas. Go through Pastanas early, and then, like I said, all throughout your day, be referring back to this book, referring to what the board answer will be, because sometimes there'll be something different that you do in the hospital than what you'll do on the actual exam. So always be referring back to the book, read up on your patients using this book, and make sure you understand each of the things within that book. Alright, so I'd go through Pastanas first, and next I would be, after going through Pastanas once, maybe twice, then I would start my UWorld questions. And I'd make sure to go through all the UWorld questions. There's only about 155, okay? And a lot of them appear on the exam or are very, very similar to what you're going to see on the exam, okay? So be doing UWorld questions. And then also use online med-ed. And you could use online med-ed using the 3-pass system. So what you could do is pre-read the PDFs for online med-ed, then you could watch the videos for online med-ed, and then you could study and post-read the lectures for online med-ed as well. Last thing that I forgot to mention earlier was use pretest. I did pretest the last week of my study, and mainly because I ran out of questions to do, and it has 500 questions for surgery. So that's 3 times as much as UWorld, and it was very helpful as well. Alright, so Pastanas, online med-ed, UWorld, and pretest, and you should crush the shelf. Alright, so last thing before I board my last flight is surgery for me? Honestly, I love surgery. I loved everything about surgery, and there's kind of a system that you have to go about to find out if surgery is for you. Okay, so number 1 is, do you like surgery? Most people will love surgery, so this kind of moves them on to the next question, which is, can you handle the lifestyle? The lifestyle of a surgeon is very intense. It is long hours, and you have to make sure that you could handle that lifestyle. And then the third question I'd ask, is there anything that you love more than what you love surgery that might have a better lifestyle? And if you do love something more, or you're more passionate about a different area, then that's what you should follow. And that's kind of where I feel like God may be leading me, is that I love surgery with all my heart. But the days that I'd come home and was so excited to talk to Phoebe was days where I got to console and comfort a patient with cancer, or that I got to pray with them and be in their room and just talk to them. And that's not saying I can't do that in surgery, but I don't know. I just feel like God might have something else for me outside of surgery, because my most passionate, my most exciting days were being with people when their hope was lost, when they thought that they might have a life-ending illness, and I was the one that got to comfort them and get to show them God's love. And so I don't know what that means for me. I don't know what I'll go into. I still have a long time to decide. But yes, I love surgery, but I'm still keeping an open mind and trying to follow what God has planned for me. Alright guys, well that is it for this surgery series. My surgery rotation is over and this series is done with. I hope you guys have enjoyed. If you have, please like, share, and subscribe. It helps me a ton. And make sure you stay tuned for the next series, which is Internal Med, Wedding Shred. I love you guys.
Shine.